Hi, this is Anna Rumbach, and today I'm presenting what helps speech-language pathology students become competent clinicians in the field of voice, an investigation of students' perceptions. So first of all, I'd like to start with some acknowledgements. So the authors wish to acknowledge the participants in this research for giving their time. We also would like to acknowledge that there was ethical approval for this research granted by the University of Queensland, with all participants in the study providing written informed consent. Also, Katherine Dallaston, a co-author on this paper, was supported by an Australian Postgraduate Award for part of the duration of the project. We'd also, as a team, like to thank the Voice Foundation for giving us the opportunity to present this research. So in decades past, speech pathology students' development of competency was primarily supported using a traditional model of work integrated learning. So this is where a student works with and beside a clinical educator in a workplace environment. This was due to the availability of sufficient placements and clinical educators. However, this is no longer the case given the large increase in speech pathology student numbers in Australia, increasing numbers of university programs, and constraints for student placements within the workplace. Now more than ever, we're under pressure as educators to optimise the effectiveness of the teaching and learning approaches we're using to support students' competency development. We also know that attainment of competency is influenced not only by the development of skills and knowledge, but also personal attitudes, values, and abilities. So taking this into consideration, we came up with a research question: what factors do students believe help or hinder their development of clinical competency and confidence in the field of voice? So to help answer this research question, we used focus group methodology. So we conducted focus group interviews with a convenient sample of speech pathology students to ask them directly about their perceptions of factors impacting their own and their peers' development of competency in voice. Prior to recruitment into the study, all participants had completed a mandatory course dedicated to voice held in the first university semester, either in the second year of a 4-year undergraduate program or the first year of a 2.5-year graduate entry master's program. The coursework related to the voice range of practice area consisted of 42 hours of lectures, in-class demonstrations, and case-based discussion that covered foundational knowledge of the voice and its disorders across the lifespan, and also the assessment, diagnosis, and management of pediatric and adult voice disorders. In the following semester, all students then completed a voice simulation clinic as part of their clinical education program. At this stage of their professional training, no students had experience in voice assessment and management with real clients. So 14 students participated across 4 focus group interviews. To increase the students' comfort to participate in an open, frank discussion, the 4 focus group interviews were conducted by a member of the research team who was not known to the students, nor was a member of teaching staff. We used an interview guide to structure the conversation around factors affecting students' development of competency. We also included some questions that were designed to encourage broader reflection on the experience of learning about voice, beliefs about voice as a field of practice, and their perceptions of voice clinicians. So interviews were recorded and transcribed verbatim, with interviews lasting between 45 and 60 minutes. So for data analysis, an inductive approach was used. This was due to the exploratory nature of the research question. This ensured that the themes identified were strongly linked to the data themselves, and therefore the participants' experiences, not to the researchers' theoretical interest. Interview transcriptions were analysed using template analysis as outlined by Brooks, McCluskey, Turley and King. Template analysis is a form of thematic analysis which provides a systematic approach for analysing qualitative data. Central to this approach is the development of a hierarchical coding template, which is constructed early in the analysis process, which is then modified and refined as necessary through the analysis process. So looking now at the results. Data analysis revealed 2 central themes that students perceived to contribute to the development of competency and confidence in voice. These were personal and educational factors. Themes peripheral to the research question were also coded during analysis. So in taking this approach, we hope to report what factors students believe impact their development of competency and confidence when it comes to voice, but also shed some light on why they believe some factors to be influential. Because of the large amount of data required, I'll be providing a bit of a snapshot of the results today. So overall, participants considered speech pathologists working in the area of voice to be specialists. But despite participants believing voice clinicians are only a relatively small portion of the workforce, participants agreed that all speech pathologists need to possess basic competency in voice, because demonstration of competency in voice was particularly important as speech and voice are not mutually exclusive. So voice and knowledge and skills are transferable to other clinical areas. Participants also felt that it is rather important for the community at large that voice services available are delivered by competent clinicians. So the participants believed a clinician's own voice, so their own vocal health and vocal skill, are a vital component of clinical competency. In addition to the belief that a clinician's own voice underpins competency in voice, participants identified students' own voices as impacting the development and attainment of clinical competency. Participants explained the ways in which students' own voices impact upon competency by giving examples of why, if students do not have adequate voices, competency is not achieved. One participant believed that poor vocal health compromises the perceived legitimacy of a clinician's advice to others. Participants also spoke of the impact of poor vocal health on students' capacity to elicit voice change in their patients. Similarly, underdeveloped vocal skill was identified as a barrier to eliciting voice change in patients. Overall, participants described confidence in using one's own voice as something that would come the more you practiced it. Clinical experience was also believed to increase confidence. One student said, if you get more experience that you know that you're doing what you're supposed to be doing, then it gives you that confidence to show someone else. Overall, self-reported confidence in the ability to demonstrate vocal tasks varied across participants. A low level of confidence was reported as impacting students' willingness to provide voice-related services post-graduation. Now looking at vocal background. Students with a performance background were considered to be at an advantage in terms of ability and confidence regarding the performance of vocal tasks. However, students also believed practice would improve their performance, even in the absence of innate vocal ability and prior training. Participants perceived voice clinicians to have the same personal qualities as other speech pathologists. However, they thought voice clinicians had more extensive training in and exposure to voice in different contexts. Participants reported that to work with some client groups, a background in singing and vocal performance is useful. The knowledge of vocal performance would give the client more confidence in the clinician's ability to tailor a voice therapy program that's suitable to their lifestyle and vocal needs. Now looking at approach to learning. Participants unsurprisingly reported greater success if their learning style matched the teaching style in which the material was presented. Students thought there was a lot to learn and there was a bit of rote learning instead of full concept reasoning that was required in the earlier stages of the learning process. And to ensure that students could demonstrate competency for theoretical curriculum, participants reported using a number of different learning strategies, including strategic and rote learning. Now, in terms of educational barriers and facilitators, face-to-face demonstrations of theoretical concepts and voice therapy techniques within lectures provided greater saliency for some students. Additionally, voice demonstrations of voice techniques in isolation were helpful, with videoed clinical examples helping facilitate students' transition from the classroom to the clinic. Peer learning was also considered a facilitator and was commonly used with students practicing vocal techniques in groups and seeking guidance from students in higher, more advanced year levels of the speech pathology program. The simulated patient clinic afforded students the opportunity to practice vocal techniques and received individualised feedback. So they perceived feedback as particularly important for individuals with reduced awareness of their own voices. There was, however, limited practice of voice techniques and absence of specific individualised feedback regarding performance accuracy. And this left some students feeling as though they were learning how to perform the voice techniques at the same time as the client, as evidenced by this student's quote. At the time of the interviews, participants reported varied perceptions of their own competency to work in voice. Overall, they felt they hadn't had enough exposure, as it was rare to gain practical experience in this area of practice as a student. Participants perceived voice to be a difficult caseload for new graduates, that they would need more guidance and support from experienced clinicians. They also highlighted the value of the simulated patient clinic experience in terms of them being able to consolidate their learning with a clinical practicum in a supported and safe environment. Participants believed that to be confident and competent to work with voice clients, they would require additional training after university. So what does this all tell us? This study identified a number of personal and educational factors that students perceive to impact their development of competency when it comes to learning about voice. Consideration of these holistic factors may assist us as educators to deliver optimally effective voice-related curricula. We want to maximise the students' ability to learn and enhance their performance. One of the educational factors that students in this study identified as impacting their development of competency in voice was their limited exposure to practical training and clinical voice caseloads. So, although the clinical curriculum and work-integrated learning experiences provided in accredited undergraduate and postgraduate speech pathology programs in Australia are sufficient for students to develop minimum skills and knowledge base required for entry-level practice, students continue to acknowledge that an ability to skillfully treat clients with voice disorders is dependent on experiences post-graduation. So, how do we provide students with more experience? You might be interested in accessing this further presentation that might provide a little bit of an insight into what we're doing to solve that question. So thank you for listening. If you have any questions, queries, comments or feedback, please feel free to send me an email. Thank you.